McCain is one of about a dozen Republican senators who haven't said where they stand on the health care bill. He's been getting an earful from Arizona's Republican governor, who is worried about the bill's deep Medicaid cuts. And Elaine, that's what has supporters of the bill really nervous. They're worried that as long as this process drags out, which could happen if McCain takes a while to recover, the more that kind of opposition will get amplified.
Nancy, do we have any idea of the timeline at this point?
Well, McCain's office has said that he is going to take the week to recuperate on the advice of his doctors. And when we spoke to Senator Lindsey Graham, he gave a similar timeline. Of course, we don't know what the pathology tests are going to show from the examination of that blood clot. We know, according to the statement that came from the doctors, they're going to get the results of that pathology test, and then they're going to need to go over treatment options, if any, with the senator and his family. So there are a number of things that could potentially inhibit him from coming back to Washington at the end of the week, but according to Graham, he is chomping at the bit to get back.
Well, at an event today, President Trump said he hopes Senator McCain gets better soon because they need his vote. What type of role do we know is the president expected to take as Senator McConnell works to bolster support among his base?
The president really hasn't been taking much of a role, Elaine. He had a couple of overseas trips, and he hasn't really gone out on the road here in the U.S. to sell the health care plan. And he's sort of been kind of a mixed voice at times for the Republican Party, sometimes urging senators and House members to just get on board and vote for the plan, and other times, castigating a bill that had already passed as mean, which was viewed widely here on Capitol Hill by Republicans, at least, as incredibly unhelpful and somewhat embarrassing for those who had decided to vote yes. So they haven't asked a lot of him, and in return, he hasn't really done all that much to go out and sell the bill or to really twist arms of individual senators beyond a few early morning tweets.
Well, the Congressional Budget Office says it will take more time to analyze the new health care bill. What was the reasoning behind that, and what does that mean for the chances of the bill?
Well, the CBO was already under a lot of pressure from Republicans to try to get this analysis done quickly. It had analyzed the first version of the bill, then Republicans got together, reworked it, and they wanted to hold a vote this week, so CBO was moving very quickly to try to get them a new analysis. The problem is that this bill contains an amendment from Ted Cruz that didn't exist at all in the first version, and CBO says it could take some time to try to figure out the impact of this proposal, whereby insurers could offer cheaper bare bones plans to healthy people while keeping sort of Obamacare mandated plans for people with pre-existing conditions or for the sick. Republicans, many of them, argue that this will give people more choices, but the insurance industry has weighed in and said it's unworkable. It's going to lead to premium increases for people who aren't healthy, and it's going to lead to a big loss of coverage. So basically, senators are waiting to see what the CBO thinks. Does it agree with the insurance companies, or does it agree with Ted Cruz that this is a step in the right direction?
All right, Nancy Cordes on Capitol Hill for us. Nancy, thanks.
You're welcome.